Welcome to the Birth Lounge Podcast, an empowering space for expecting and new parents to hear candid conversations with experts, support your mental health, and learn the tips and tricks that thousands of parents have used to craft their ideal birth. We will answer all of your questions, the scary ones and the weird ones, to help calm your fears and feel confident going into your birth. I'm going to help you redefine what birth and motherhood looks like and how to embrace your journey. I've intentionally crafted a list of experts to help you navigate pregnancy, explore your birth options, and plan for postpartum so that it can be a time of soaking in your tiny human. We're going to go there on all the hard topics so that you can dive deep into finding your confidence and freeing yourself from fears around birth. With over 10 years of experience in family education and a master's degree in human development and family studies, I created this podcast as a way to share the resources parents need to make educated and informed decisions about their care in pregnancy and childbirth. This is a birth community driven by evidence-based information and research in hopes to help you explore your options, understand your rights, and know what choices you have along the way when it comes to birth and beyond. I'm your host, HeHe. Now let's get to the good stuff. Hello, have you heard about my completely free class that teaches you 6 evidence-based ways to avoid a C-section and reduce your tearing in labor by up to 50%? And remember, I mentioned it was completely free. This class is going to teach you how to advocate for your preferences in the birth room so that you can have a birth that's filled with joy and not birth trauma. Advocating for yourself starts with being empowered with the right information so that you can ask the right questions and confidently make decisions during labor based on what feels good to you and your baby. But here's the thing. The U.S. has one of the highest C-section rates in the world, and it is ever climbing year after year. And it's not because the system is broken, albeit it is, but it's really because women don't have the tools to navigate that broken system. We may not be able to change the system before you have your baby, but what we can do is change how you operate within that system. Change the conversations that you're having with your providers. Change the places that you are getting your information to help you have informed conversation with your doctor before you have your baby. I want to teach you how to do that. We know the reasons that our C-section rates are climbing. We know the reasons that inductions happen so often, and we know the reasons that babies end up in the NICU. I want to help you avoid all of that so that you can have a birth that you love. You can find my free class at thebirthlounge.com/C-section so that you can learn 6 evidence-based ways to avoid a C-section and reduce your tearing in labor. Again, that is thebirthlounge.com/C-section. See you there. Bye. Hello, and welcome back to another episode of the Birth Lounge podcast. All right, you know something that commonly pops up in my practice as a doula, and families often find it confusing. It can be hard to understand the root cause. It can be hard to find a practitioner that understands what you're going through. It can be hard to understand what the research says, and therefore hard to understand what options you have to resolve this. And that is eczema. I'm so excited to be being joined by Dr. Nina Marie, who is a traditionally trained naturopathic doctor who focuses on perinatal and pediatric health. I started following her on Instagram, and I was shocked by how much I learned. She has taught me so much about gut health, the microbiome, eczema in children, and what kind of options we have in terms of helping those kids, helping get rid of it, actually getting down to the root cause. One of my favorite things about Dr. Nina Marie is that she takes a tailored approach to find out exactly what your baby's body needs through functional testing so that you can actually tackle the root cause. You guys hear me say test, don't guess all the time in pregnancy and your prenatal appointments and how you manage the end of pregnancy, but it's so smart to apply that same concept after your baby gets here to make sure that we are supporting their body, their immune system, their health, their gut health to be the best that it can be. In today's episode, we are going to talk all about how do you identify mineral imbalances? How do you understand your child's gut health? What do you do if you're noticing signs and symptoms that may be pointing to some sort of gut health deficiency or imbalance? And specifically, what about eczema? How do you know if it is eczema? Who should you be contacting as far as a provider or practitioner to help you do that? What kind of tests are available to help your family understand exactly what you're dealing with? And then how do you take those results and find individualized care to help your baby get rid of whatever you guys are dealing with? We're also going to be talking about probiotics. Now, some people are pro probiotics, and then some people think it's just Mad Hatter science. So, we're going to talk about what the data says and how to pick out a high quality probiotic. Where do you get those, and what strain do you specifically need? Buckle up, because this is not going to be any sort of information or education that you get from your mainstream pediatrician. And I'm so excited to be diving into this with you. So, without further ado, Dr. Nina Marie, welcome to the show.
I am so excited to be here. Thank you so much, Haley.
Absolutely. I'm so excited to have you here because you are someone on Instagram who I have followed for a long time and someone who I have genuinely become educated because of your page. And I get messages on Instagram like that too. And but like, how much are they really getting on Instagram? And then I have
Mhm.
pages like yours where I'm like, no, genuinely, you've educated me so
Mm.
much. I have a whole list of questions that is very unusual for me to come to a podcast with questions, but it's questions that have come from your Instagram where I'm like, wow, she's getting my wheels spinning. She's getting me asking questions. She's getting me thinking about things that I did not even know were questions that I should be asking or topics I should be thinking about, or I didn't even know this happened in children. Honestly, thank you so much for being here. I'm very excited for our people to be able to learn from you because I feel very blessed to have been able to learn from you. Before we dive into all of the like real nitty gritty, could you give us just a brief overview of gut health and why it is so important when it comes to our overall health? Because
Yeah,
obviously, eczema, mineral imbalances, probiotics, that all has to do with gut health. But I think maybe laying the foundation of why gut health is so important will help set us up to understand how we actually have control over so much other stuff.
that's a really wonderful place to begin because gut health is foundational to all other aspects of health. There was a long time that I would say our next generation comes with every bite you eat. And that is because the food that we are consuming is going to be broken down into different nutrients, amino acids, minerals, vitamins, etc., right? And those are the things that then go on into our body to form tissues, to form our brain matter, to form our spinal cord, our skeletal system, cardiovascular system. All of the things are built up because of the food that we're consuming. So your digestive system needs to be in optimal shape in order to extract all of these things to then go on, build up your own body, and then during conception, pregnancy, and even postpartum with breastfeeding to build up the body of someone else. So it always starts with your digestive system. If we have an imbalance in microbes or not just microbes, there's a whole ecosystem in our gut. And that does start, I will add here, it starts in your oral microbiome. So there are specific microbes that need to be flourishing in your mouth. And when they aren't, we start to develop cavities, and then that will overflow into the gut microbiome. And from there, potentially lead to more digestive dysfunction and then move on to other parts of the body. We know about the gut brain connection or the gut liver connection. There's even a gut mammary gland connection because there's so much fluidity or movement between these microbes in the rest of the body that without appropriate care, you have loss of appetite, behavioral concerns, eczema and skin conditions. You can have gas bloating. You can have insomnia. So your sleep is disrupted. You have growth concerns in children. We have failure to thrive. Your bladder might become irritated, et cetera, et cetera. So there's really a hand in so many different parts of the human body that stems from what's happening in the GI tract.
It all starts with your gut, and so many
Yes.
people don't realize that. Wow. Okay, so sidetracking us just a little bit right off the bat,
Yeah.
obviously. How do you cultivate good and healthy oral microbiome? Is it really just as simple as brushing your teeth every day regularly, like we're taught, and then flossing?
That's definitely part of it, but it is not the only part. Many people end up with cavities because of mouth breathing, not necessarily because they're not brushing or reducing sugar, etc. But how the oral microbiome is oxygenated is important. And that can lead to the overgrowth of specific pathogenic bacteria in the oral microbiome that then leads to cavities. So, the way that you breathe, how the types of foods that you eat for sure, oil pulling, brushing, flossing, all of those things are important. But I would say breath and breath work would be oftentimes primary over dental hygiene.
Wow. Okay, incredible. Another side step. Is there any connection between gut health and cancer that dropped into my head as you were speaking? And I was like, oh my gosh, what is that?
Yes. So I actually had one pediatric client that I worked with. It's probably 2 years ago now. And she lived in, I want to say, Rhode Island area. And so we were doing a stool test because of the types of concerns mom had for her daughter. And while we were waiting for results, she was messaging me on the client platform, like, these are new symptoms that popped up for my child. What do I do? And they were very similar to symptoms for Lyme. And since I knew that she lived in Rhode Island, and there can be a big tick population there. I was like, you should go to the ER and roll out Lyme while we're waiting for test results. In the ER, they ran a bunch of tests and it ended up being cancer. It was nothing than what we thought it was. And it was a huge curveball to that family. However, when I received the results back after knowing what was going on, there were very specific things that showed up on her test that I had never seen before. One of those was that she had the highest number of secretory IgA I had ever seen. And that is a marker that points to your immune cells, your IgA cells. And it showed that her immune system was hyperactive. Now, normally seeing this on a high end in a non-cancer setting, or I would say, I'm not super concerned because usually there are things that are happening in the GI microbiome that warrant the immune soldiers to go out to battle. But her levels were so high that they could not count. It was like beyond their limits. So that's something that you may see, is that the immune system is so hyperactivated. When it comes to specific strains of bacteria, I think that might just depend person to person on what diet may look like or lifestyle may look like. But a number one thing that I would see is that immune system activation.
Wow. Okay. And do you think that people, and I guess not do you think, but what does the data show us about people who live in different regions of either the US or the world and their gut health?
So that makes me think about some of the research from, gosh, what there's a company out there who will pay you for your stool. Uh,
Wow.
you have to apply depending on specific health markers because they're doing all of this research.
My only poop
Yeah,
deposit.
it is. And it's for like fecal matter transplants because there are individuals who have something like Crohn's disease or inflammatory bowel disease, IBD. Yes, that's correct. There's such dysfunction occurring that when there is a fecal bowel transplant, you're taking the good microbes, the good microbiome from one individual, inserting it into another, that a lot of things go into remission because of that. So some of the research points to indigenous groups not having specific markers that you would see in Western society today. So I'll add a couple caveats too. Your gut microbiome is not permanent. It is transient and it can be altered based on food and lifestyle. And I want to emphasize lifestyle because obviously we can think about food and its impact on the gut microbiome, but even your sleep can impact your gut microbiome and vice versa. Your exercise and or lack thereof can impact your gut microbiome. So there's things that you ought to be doing that if absent can lead to dysbiosis, and the other way around. If there's dysbiosis, it can lead to activity that you probably shouldn't engage in because There's different pathogens that may send signals to your brain saying, do this because I want this outcome. And you now have this craving for X food because the pathogen within you wants it, not necessarily because you do. So there's a wonderful, beautiful relationship that when healthy is beneficial, but when we are lacking in what is appropriate for human living, whether that be what we are doing or what we are eating, there's going to be impacts in the gut microbiome, and then how that outlook, what the outlook would be in life depends on what kind of changes may take place.
That's so interesting. It's also comforting to know that if you do have a wrecked gut, you can fix it. And the
Oh
thing
yes.
is, there's hope, for lack of a better term, to get your gut healed. Okay, I need to know more about the sleep and gut health kind of connection there. Tell us about, what are you talking about that your gut health can actually disrupt your sleep, or your sleep disrupts your gut health?
So when I'm looking at a stool test, there are specific markers if sleep is a concern, especially with children. So one of them is a pathogen called, or a parasite called Giardia. When it is present, it could be asymptomatic, but it often will lead to sleep disorders. The beneficial microbifidobacterium, it will help produce different types of B vitamins, but it also can, when low, lead to low melatonin production. So it can help with melatonin. So not having enough bifido can lead to poor sleep. Another strain would be lactobacillus. When that level is low, it can lead to disrupted sleep as well in children and in adults. And then there is candida. Candida can lead to disrupted sleep in children and adults as well. So a fungal infection, a parasitic infection, and then missing microbes that are beneficial to the GI tract and human health can all lead to disrupted sleep. So there's, because of their connection to melatonin production or B vitamins that are necessary for utilizing iron, which is helpful for sleep as well. So a lot of children, mom will start an iron supplement when there's disrupted sleep, and oftentimes it will resolve. And I am not in any way advocating for anyone to go and pick up an iron supplement, but there's definitely other pieces of the puzzle involved there. But when that is occurring, that definitely tells me we've got these missing pieces. It could even be in the gut and not just a nutrient itself that would then correct the sleep problem. So it's not a behavioral issue. Oftentimes it's a nutrient issue, not to negate potential behavior issues, but looking there can be much more long-term solution than quick fixes.
And also just getting to the root cause. You can fix the behavior and you still got the
Absolutely.
parasite, or you still have
Yes.
the imbalance. So it's deeper than just, oh, your child isn't actually acting out because they want to. It is deeper than that. It's truly, let's get your child healed on a very core level. So you've given us some really solid examples of what maybe these mineral imbalances or gut health imbalances could look like. What else do parents need to be on the lookout for as far as signs and symptoms that are really common, but maybe missed by a lot of parents because they just don't know necessarily to look for them?
For gut health specifically?
Yeah, or any sort of mineral imbalances, just common things that
Oh
you
man.
see parents come into you, and you're saying like, wow, we missed that for a long time, and almost like maybe wrote it off as something like behavior, or as, oh, it's just their age, or as, oh, they must be having trouble with this life transition. We just moved, we
Mhm.
just got a dog, we just had a death, where in reality, no, it's deeper than that. It's a mineral imbalance, or it's a gut health issue.
I'll start with this. Minerals are involved in every single physiological process that takes place. So if there is an imbalance somewhere, mineral balancing can often resolve what is happening, because minerals will spur on hormones that need to be produced, or enzymes that need to be used or secreted, or et cetera, et cetera. So they are like the machine that helps things go. And if something is not going, minerals may be why they're not going. So some things that may result be the result of a mineral imbalance: ADD, ADHD, aggression. So that you think, oh, this is just a 2-year-old, this is a terrible twos or terrible threes. Oftentimes it's we're missing sedative minerals that help calm the central nervous system, and or there's the presence of heavy metals in amounts that are now causing an excitatory response in the central nervous system. Picky eating sometimes, oh, it's just a 3-year-old or it's just a 4-year-old. And there is a developmental aspect to picky eating, but oftentimes there are specific minerals missing that when brought in, we can see picky eating resolve. Asthma has some mineral imbalances connected to it. This is why during asthma attacks, if you are in the hospital, they'll administer a magnesium IV, and that will help calm your respiratory tract so that you're not having this overactive response with breathing. You may have things like constipation and diarrhea. There may be even seizures in some instances with mineral imbalances. You can have dental concerns like cavities because we're not getting the minerals like calcium or phosphorus or even magnesium into the bone. Mental health issues like depression and anxiety. You can have growth concerns, failure to thrive, short stature, even rickets. I had a client with rickets that was supported for resolution through mineral balancing. There might be hair loss or headaches, hearing concerns. You may have menstrual irregularities for your adolescent daughter. There could be nausea. Noise sensitivity is another one. If you've got a child and you go to the public bathroom and they can't handle the toilet flushing or the drying of hands, that oftentimes can be low magnesium or low phosphorus. So there's sleep issues as well, missing specific minerals that could be beneficial to helping the body relax and produce GABA, which is like the calm down button for before bed. You may have things like eczema or rashes. Like there's minerals are involved in all of the things. So if something is off, that mineral testing is the least invasive, most inexpensive option that will bring about quick results because you can adjust diet or bring in specific supplementation and see results within a few weeks.
Okay, and who does this testing? So if someone's listening, they're like, oh my God, I gotta get my child tested. What kind of practitioner are they going out to find?
That's a great question. I sigh a little bit because you're not going to get that from your primary care physician. They oftentimes will, the majority of the time, will not know what an HTMA test is, a hair tissue mineral analysis, how to get one, or think that they don't give you appropriate information. And quickly, my response to that is they don't understand the test and its parameters, and that's why that opinion exists. So some functional medicine doctors will know how to test for it. There's a lot of health practitioners, functional nutritionists, registered dietitians that are doing mineral testing. And so those are probably the ones that I would go to first because they're seeking out that education for mineral testing. And usually they're serial learners like me. And then my practice offers HTMA testing for children and adults as well.
Wow, okay, and what does that test look like? What does it entail and what will it tell us?
The test is a hair sample. And when you receive the kit in the mail, there's a little QR code from us that takes you to a video, and I'm showing you how to take a sample. It is about the first half inch to at most inch of newest growth. So it has to be the hair closest to the scalp. Everything else is discarded. And then you're sending that sample straight to the lab. The lab then sends me the results, and then we book a call to go over your results based on your specific concerns and how your mineral and or heavy metal imbalances are leading to those issues or concerns. And we put in a pretty specific protocol, usually, not usually, always bringing in diet and lifestyle alongside, and then working towards eliminating the supplements within 3 to 6 months at most.
Wow, okay, so short-term use of supplements to just help stair step your body to a place where it's doing it on its own.
I will say I have 10, maybe 20% of clients where I'm like, I don't know that we need to go into supplementation. Let's optimize food here. But most of the clients that I have really important, big concerns or goals that excuse my general recommendations. You're coming to me because there's a problem usually. And if there's a problem, there's usually great depletion. And most people, because there's great depletion, I will aim to utilize supplementation in the beginning because your calcium might be at a 15 when we want it at a 60. So dairy is only going to get you so far at that point, and you've been doing dairy and have no problem with dairy, and we're still seeing a low number. Yes, short-term supplementation, there may be an individual where I'm like, this is what we got to optimize, you don't need a supplement, let's do these things with food and then retest.
Yeah. Okay, you mentioned that there was a buildup of heavy metals in our nervous system. Talk to us about that. Why are we seeing this? What is causing it? And what does that actually mean for our body?
So, heavy metals are ubiquitous at this point in human history because of the Industrial Revolution and the fact that we live after it. Heavy metals are in our environment, in the air we breathe, in the water we drink, in the food we eat, even in the soil that we walk barefoot on. And the type of heavy metal that may be present in higher amounts depends on what region you live in. So there are individuals that might live in the New Mexico area, and I almost always am seeing very high uranium levels in their HTMA
Wow.
test. So there can be that regional thing to take into consideration just because what's present in the soil in that region. But because we have so many metals in all of the things, avoidance to some degree is not possible anymore. And I don't know if that's necessarily a bad thing because it requires us now to ensure that our bodies are resilient enough to just, okay, we're exposed to a metal, no big deal, as opposed to it becoming a really big problem. There were studies done on violent criminal inmates where they did HTMA analysis, and all of them had very high levels of things like cadmium and lead. And in the reduction of those metals, you saw behavior changes. You saw them become much more personable in prison. And so we know that heavy metals can lead, at the very least, to behavioral problems. Arsenic, for example, is present in chicken you might be eating because it might be in the feed given to chicken. It All of these are usually in one amount or another in tap water. And so this is where clean air, clean food, clean water are my first three things that we want to make sure are present. If I'm working with a client and we don't have water filtration, if I'm working with a client and they live in a place where there's a lot of smoke and we don't have air filtration, thinking through access to clean food, that's going to be more important to me before supplementation because no supplement is going to outrun whatever is happening with food and lifestyle. So understanding clean air, clean food, clean water is key first. Then looking into what kinds of things do we bring in with minerals or other nutrients because they have these antagonistic relationships. So knowing that we can bring in zinc for something like cadmium that may show up, that will help to eliminate cadmium from the body and just replenish the body with the zinc that may have been pushed out because of that cadmium toxicity. So while metals are present, I don't want anyone to feel afraid, like, oh no, I've got to go check every single product I've ever used ever and make sure every single product I use from here on out is also going to be metal free. It's not possible. And you shouldn't have to be afraid either, because to some degree, these are natural elements that we are meant to be living around with, etc. And exposure to the human body shouldn't be a problem. It is when the human body is under immense stress or does not have the capability for proper detoxification that it then becomes a greater issue than it should be. So, metals, yes, they're present, but if you make your body healthy, if you keep your body healthy, if you support your body for elimination and detox, then your central nervous system doesn't go crazy and you get to sleep fine. You get to have wonderful relationships with other people instead of being angry and violent all the time.
Yeah. Oh my gosh. I know so many people are having like light bulb moments out there being like, wait a minute, this might be me or this might be by my child. Okay, so I have a question about lifestyle and kind of dietary things that might be predisposing our children to imbalances. Again, not that anyone, is doing this on purpose, but just things that you see families do that they may not be aware are causing harm to their kids in terms of mineral balances and gut health.
Okay, so I there's two practices that come to mind immediately, and they're related to metals, and then metals can impact gut health, and I'll make that connection as well. The two things that come to mind, the first one is amalgam metal fillings for cavities. That is mercury. It's going to leach into the body. It's going to leach every time you or your child takes a bite and chews food. Anyone who is oil pulling should not oil pull if they have metal fillings, because that's going to pull the metal from the filling as well and then expose your body to that metal. So if you're doing metal fillings, if you or your child have metal fillings, please find a biological functional dentist who is properly trained for the removal of that filling and then the replacement with something like a porcelain filling. The second thing is vaccinations, because aluminum is one of the adjuvants, and we know that it is a neurotoxin, and we know that every single vaccine, so the ones that are just one vaccine in one syringe, has hundreds of times over the limit that we should have for exposure per vaccine of aluminum. And so whatever your position is on whether you believe that vaccines are harmful to human health and or whether you believe that vaccines are necessary for human health, it doesn't matter. Aluminum is present and it's a neurotoxin. So with these two instances, there is an exposure and in varying degrees with both of those that can lead to problems with your gut microbiome. Mercury, because it is in the amalgam filling that I noted, there is more of a detoxification protection that can occur with your gastrointestinal tract. So even though you may be swallowing it with food, your GI tract has wonderful protective mechanisms to help ensure that you don't absorb as much as possible. However, mercury in the GI tract can increase H. pylori, and it's been shown to do that. And H. pylori will suppress stomach acid. Mercury can decrease lactobacillus, which is necessary for that melatonin production that we talked about, or B vitamins. It's necessary for skin health. It will decrease bacillus species as well in the GI tract. It can also increase something called the sulfol vibrio, which will induce inflammatory immunological responses in the GI tract. So we have mercury that may be not as absorbed into the human body as much as possible when exposed to the GI tract because of the protective mechanisms that it has. But its very presence now shifts the gut microbiome. And we know that H. pylori is connected to thyroid disorders, it's connected to skin disorders, it's connected to fungal infections. And so seeing that increase will lead to potential pathogens or a pathological disease, or let's say it's none of those things. An increase in H. pylori will decrease your stomach acid, which then makes it harder for your body to break down protein. And now we don't have amino acids to build up hormones or to build up neurotransmitters or to build up immune cells. So just the increase there without any pathogenesis can lead to dysfunction biologically anyway. I then mentioned aluminum. Now, aluminum exposure through an injection bypasses your gut intestinal tract or gastrointestinal tract, which means it's bypassing an alarm response by the body, the initial alarm response through your innate immune system, and it's bypassing the lack of absorption that the GI tract can give you. And so it's going straight into the body. Aluminum will also increase Bacteroides fragilis. It will increase lipopolysaccharides. It decreases an important microbe called Akkermansia, which protects your gut lining. It helps with vitamin D levels, which supports the immune system. And so when we have these increases or decreases because of aluminum, you have increased permeability or leaky gut. You have gut barrier dysfunction. Your immune system becomes impaired, your diversity of your microbes are altered, and then your epithelial cells, the cells that make up your GI tract, go into apoptosis. So they start to kill themselves off when they shouldn't have, just because of aluminum's presence. So we know that metals will impact your gut microbiome, and that's just two possible exposures when there are many.
Yeah. Okay. So what I'm hearing is that metals are natural. Our
Mm-hmm.
bodies are designed to encounter them and know what to do with them. However, Because we live in 2025, particularly if you're in the US, there are so many things that our bodies weren't designed to also take metals on the environment, our food, our water, the soil, that our toxic load is too high for our body to actually detox. Now, on the conversation of vaccinations, if you are no vax and you already have your stance, and if you're pro vax and you already have your stance as well. But for the people who recognize, okay, I see the good in vaccines. I see how they can be good. But I am also a little hesitant because I also see what has been happening over the last couple of decades and within the government system of our country when it comes to vaccines and just them being held responsible for injuries and the honesty or the shadiness that's come along with that. What do you say to parents who are in that middle of the spectrum? Are you a doctor who suggests looking at maybe an alternative schedule that suggests spreading things out so that your baby's body does have the time to detox the metals that come along with those vaccines?
Okay, I've got two thoughts. One,
Okay.
it will be rare as a parent for you to regret not vaccinating.
Hmm.
I think it is much less rare, at the very least, for parents to regret vaccinating. So, taking your time and withholding and reading a ton or watching documentaries, etc., meeting other parents who may have different positions, taking that time to do all of that kind of independent work will not be regretted, in my opinion. I think it's easier to regret moving forward and doing something just because your physician tells you to or you think is necessary for health. I would encourage you to look at death rates for or infection rates, if not even death rates or infection rates of the specific illnesses that we are vaccinating against on the childhood schedule. And what does that look like for your child's risk? Does your child actually have a risk for something like Hep B? Does your child have a risk for something like RSV? And then what is that risk level depending on your child's level of exposure? Is your child in public school? Is your child homeschooled? Your risk of exposure is going to be very different in both scenarios. So, taking all of that information into consideration is going to be more important than whatever a specific stance is. When it comes to whether or not I am a provider who's you should be a delayed and go slowly, no, I'm not. I'm at a point where I don't think anyone should be getting vaccines at all. I was not here. I will share when I had it's probably only been like a couple of years now. My firstborn and my second born, my position was it depends on context.
Mm-hmm.
And because we lived here in the US, I was okay with a much slower and or non-existent vaccination schedule. But there were times where we traveled to South America, and because we were going to be in multiple airports and I wasn't sure about what was present, my children had specific vaccines that we worked through because of the exposure that we were putting them in at such a small age. My youngest at the time was 6 weeks old when we traveled. So I was like, I want to protect my 6 week old. If I were to go back in time and do it again with what I know now, I would not have done anything, even with the traveling to another country, because of what I know is in vaccines at this point in time, the types of ingredients present, the adjuvants present, etc. On top of that, the idea became popularized for a delayed schedule through a physician in, I think it was Oregon State. And gosh, I can't remember his name now.
Dr. Sears.
Nope, different doctor. Dr. Paul Thomas. He was the one who popularized the vaccine friendly plan, where it was a delayed schedule. And he had seen in his practice, he was the only physician, like for hundreds of miles, like people across the state would come and see him because he did not require vaccination to stay in his practice. And he saw that the kids that weren't vaccinated were the healthiest. They weren't coming in for sick visits. The kids that were vaccinated on his delayed schedule were healthier than the kids that were vaccinated on the CDC schedule. And at one point, he publishes this book for his specific research with his 15, 20 years of experience. stating utilizing the vaccine friendly plan was better than the CDC plan. So doing the delayed approach was beneficial. After his publication, the state board, medical board, put his license in suspension and required him to prove that his delayed plan was better or of equal value than the CDC plan. So he hired the best of the best to go through all of the medical data, published a medical paper that was peer reviewed, and then showing that his delayed schedule was better than the CDC
Oh, he
schedule.
did it. He
He
actually
did
was
it.
able to prove it.
He was, and then it was pulled.
Oh,
And so
no.
it was retracted. So you can't, maybe you could find it somewhere, but you won't see it in a medical journal. He has since given up his license because of this. He now practices as a health coach. And he wrote a new book called Vax Facts. It was published in December of 24, where he says, I no longer support my work in the vaccine friendly plan. It is not safe enough for children. And so if I see someone who was like, no, they're good, let's slow things down, we don't need as many, now backpedal saying the research shows that it is detrimental to pediatric health, that is more of a safe place to be, in my opinion, than full steam ahead, take all of the things and then see what happens later.
Yeah. Gosh, my heart goes out to all the parents out there that are having to make that decision. You guys know I don't have kids yet. I've not been put in that position. I'm very just grateful that I have not had to cross that bridge yet. Thank you for being so open and honest about that. I think a lot of people like Dr. Sears and Dr. Thomas, I recently had Dr. Joel Gator on the show. I think they get a lot of pushback and a lot of flack online and in person, and just they get a lot of hate for speaking something that is not considered mainstream. Obviously, some people's opinions is going to be that that's negligent or that is misinformation or that's not according to the data. But for me, I do love to highlight both sides of the talk so that people can actually have the information they can go out there and ask that themselves. So I have one last kind of remaining question, more about the aluminum and the metals that are in vaccinations. If when it is given as an injection, which is IM, right? Intramuscular, is that how we're given vaccinations? So
Yes.
when that bypasses that GI tract filtration, how does that impact the human body, specifically in pediatrics, in that detox process? How does that disrupt that? It must disrupt it in some way if it's not going through the channels that our bodies were designed to go through in order to detox these things.
Okay. In the immune system, we have different barriers. Okay. You have your innate immune system, and then you have acquired immunity. The human immune system takes at minimum 2 years to begin to become mature. And some research says age 6, age 7 is when the immune system is now mature on its own. So at birth, what an infant has is passive immunity that was passed on from his or her mother. So, depending on what mom had during pregnancy, because she may not have certain immune cells, because if she was vaccinated against measles when she was a kid, instead of contracting measles, she doesn't have lifelong immunity anymore. So, she doesn't have that to pass on. And so, depending on what immunity mom has, she passes that on to her baby. And the baby has that for the first 6 to 12 months at most in of its life. There might be more passed on through breastfeeding because of the immune cells that are passed that way, so that you can prolong some of that passive immunity based through lactation. When it comes to understanding the bypassing of the immune system, so in innate immunity, we have things like secretions, sneezing, coughing. Your stomach acid is meant to kill things off. If we don't have those, then we are missing the first like red alert signal that the body would give if it was presented to the body through those barrier immune possibilities or places. So Your saliva, there's an immunological response there. Stomach, digestive tract, there's 80% of your immune system is in your digestive tract for a reason, because that is how we are supposed to have our first red alert, is through tasting, smelling, etc. And so when this is bypassed and something is injected into the body, we don't have the specific cells that would have been giving you the alarm going off. And so what the body will then do is try to play catch up with its immune response. And one of the ways that it does that is it can encapsulate what that pathogen is. And you'll have prolonged fevers. So instead of having a fever that lasts a day or two when you're ill, you now get fevers off and on for a long time. It could be a week, it could be 2 weeks. And that sometimes with vaccinations, there's just fevers off and on for a while. Earaches and ear infections is another one, because babies don't have a eustachian tube, or infants, toddlers don't have a eustachian tube that is tilted down like adults. It doesn't drain well. And so the immune system it tries to encapsulate that thing and takes it to a near place of drainage. And the ear canal is one of those places. And so you have this recurring ear infection because the immune cells that were supposed to be your first line of defense aren't working. And the second line of defense is trying to catch up. And so you have all of the same types of recurring problems. So with the hepatitis vaccine, you see a lot of liver issues. Hepatitis is supposed to support the liver. With polio or diphtheria, you have a lot of nervous system issues when polio or diphtheria can affect the nervous system when contracted in the wild, it's said, or naturally. Chickenpox vaccines can lead to skin issues. And we know that chickenpox typically leads to skin issues on its own, or even nervous system issues, which is why later in life it can become reactivated and shingles can occur because of that nervous system issue. And so measles could be digestive problems. And we see the MMR often connected to digestive issues in children. And so missing our first line of defense, our barrier immunity for the coughing, the sneezing, the fevers that are supposed to occur at onset, then leads to prolonged general immune responses instead of having specific immune responses.
Wow, that is so fascinating. And you can see how the things that we do at birth, actually pre-birth, in pregnancy, as someone who is thinking about trying to conceive, matter so much because it actually is the foundational kind of building blocks for your baby's gut health. Okay, I want to shift a little bit to
Mhm.
eczema because I think that's one of the number one things that when you see a baby with eczema, or if your baby has eczema, most people are thinking, okay, gut health.
Mm.
Tell us about how gut health and eczema are connected.
Oh, okay.
It's
For
deep.
there are a lot of potential pathogens that may be present that can lead to eczema. So there are, I'll start this way first. There are specific microbes that are, when imbalanced, can lead to something called the atopic march. It starts with eczema, it can lead to food allergies, and it ends in asthma. It's a step-by-step process. And so eczema in early childhood and infancy oftentimes is a precursor to asthma later on because of that. And there the microbes that might be involved. So there is, or pathogens, if not just microbes. So Yersinia enterocolitica is one of them. You can have different like Staphylococcus species. You can have fungal issues like Candida. You may have, I've seen in the last year, there were two kids that had probably the worst eczema I've seen ever. And both of them had C. diff or Clostridium difficile. And so eradicating that in an infant is so hard. So there's so many different possibilities. The main ones that I see over and over again are going to be your staph infections, your fungal or candida infections, and then there's one of two possibilities with the immune system depending on how long it's been going on. So if this is a child who has had chronic eczema for a while, I often see that their immune cells in their GI map stool test are like bottomed out. Like the immune system cannot elicit a response anymore. If we're catching it early, it's been eczema for a few weeks, maybe a month at most, then you have the opposite spectrum. You see those immune cells are activated. And in that moment, I'm like, good, we want to see it activated. Let's support its activation because it's trying to prevent or eradicate the problem that we're seeing in the rest of the test or in the rest of the gut microbiome. So one of the reasons eczema becomes a result of gut imbalance is because of the inflammation that is occurring. And so many of these microbes will lead to more inflammation production, or they diminish, or the pathogens can diminish beneficial microbes that produce the anti-inflammatory effect in the GI tract. So this is where having a like comprehensive look, not just going after specific pathogens that may be present, but optimizing the beneficial parts of the microbiome can then let the gut microbiome do its work on its own and not need all of the supplements forever and ever or keep going back to the same thing because we have another flare. It's because there was no true resolution to whatever the problem may have been in the GI tract that these flares may be recurring. Is that helpful?
Absolutely. And now my question is, where would a baby be getting C. diff or staph? Are we passing this down from mom, or is this a hospital-acquired infection from birth or something else?
It could be any of the above. So one of the kids, I really do think it was a hospital acquired infection. The second one was a home birth. So I don't think that's what it was. It may have just come from, no, that's not true. The second one, they lived on a farm. And so it had to have been just something in the environment. So C. diff is crazy and hard and it can leave you hospitalized. So to see that in children is just so heartbreaking. But it doesn't have to be that way. This is where I go back and forth on my opinion for things like direct to consumer tests. So there's different organizations that allow now for you to just order a test on your own and get results. That can be a blessing and a curse because if you don't know what to do with the results or you don't have someone to help you know what to do with the results, you're going to Google things and then think the worst or think that it's no big deal, one or the other. But at the same time, direct to consumer testing allows for families to just really take hold of their own health. And so there are specific tests that clients will like bring to me because of their options that they have now. And it has benefited some of these families. Like they're often lower cost than what you would get from a normal typical provider. And it helps to give them an answer on this is what's going on now. And so the only thing I'll add there is if you are looking at purchasing a direct to consumer test, please ensure that if you're not working with the creators of the test or their team, that you're finding a reputable practitioner, physician to work with you on what the results are. Don't DIY it.
Yeah, that's my feeling too, is I love the access that direct to consumer test has allowed for parents to get answers or like for myself to get answers about my own body. But I do always recommend, and I follow the same advice, I always work with a practitioner that's willing to look at my results, set me through interpreting those, and then helping me understand a plan, an action plan, if you will, of how do I take these results and then do something with them to help improve whatever I am looking at. Okay, so in terms of eczema, do you think that there's any benefit at looking at what a breastfeeding parent is eating, or have we surpassed that when eczema is present and it's more likely a gut microbiome, gut health thing? So keep breastfeeding. Let's jump to a stool test.
Maybe. I don't know that there's a clear cut. Oh no, definitely this. So I okay, so I've had a couple clients recently. Their infants have chronic eczema. Mom had eliminated some foods from her diet and saw some relief, but it wasn't permanent. And every so often her daughter would still have flares. So in that instance, like it's not a food, there's something else going on. And so if you've already eliminated and you don't see full resolution, then testing for sure could be beneficial. But at the same time, removing a food on its own should not be the end for someone because your body's not supposed to respond to food that way. And then your food sensitivities can change honestly day to day, especially with infants, because your gut lining does not become more solid till at least year two, which is why some people say immune system maturity at year two. And if you have a permeable gut lining, food proteins can pass that gut lining immaturely. And then you have this alarm response to peanut or to milk or to egg that's not supposed to be occurring because it passed too soon. So it might be eggs today, it could be beef tomorrow, and then it's going to be chicken the day after that. And so food sensitivities aren't the root problem. And so eliminating them may bring relief, but another food is going to become an issue. And then you're eliminating that. And then you come to a very restricted diet.
Which sucks. No one wants to do that. No
Oh,
parent wants to do that. No kid wants to do that.
and I've seen so many moms who are eliminating foods because of their child's eczema and are on such a restricted diet that they're now malnourished and
Oh.
they are not feeling well. And that is not beneficial to anyone here. So if food elimination is resolving eczema, that still gives you a clue like something's going on. Why are we not responding to foods well? We probably need to bring in some supports for the immune system to act the right way or act normally. So while it can bring in some temporary relief, it's never the end solution for anyone, in my opinion, if
Yeah.
that helps.
Yeah, absolutely. So, how young can we actually do a GI map on a baby? So, let's say your baby is born by 2 weeks, you notice some scaly, kind of flaky skin. You're wondering if it's just them transitioning to the outside. You're wondering if it's winter time and you haven't put enough lotion on. You're wondering if the clothes that you bought are roughing up their skin. So, you try all that stuff. But by a month old, it's pretty clear that this is getting worse. It's not getting better. And you're starting to wonder if there's gut health concerns. Can we run a GI map on a baby?
Yes, ma'am.
Wow.
I've done 6 weeks, 8 weeks before. And the research through some of these companies are now providing what the gut microbiome looks like for infants that young or even newborns, that we have data that we've never had before because of it.
Oh my God, that's so exciting.
Mhm.
Okay, so let's say we get a GI map. We see, all right, we've got some gut health issues. We've got some eczema going on. What are we looking for in terms of resolutions? What are we looking for in terms of how do we fix this?
It definitely depends on what shows up. If mom is breastfeeding, oftentimes I'm having her take the supplements to
Wow.
that's definitely a part of the mix no matter what. And then she's able to pass things on through milk that way. So if the baby is like 4 or 5 months old, I usually want mom to take the binder that is safe in pregnancy, and then baby gets the byproduct of that. If the child is older and food has been introduced, then we may be able to mix things into milk, applesauce, etc., and have them take a binder or an eradicating agent that way. I definitely try to have mom take the eradicating agent at least partly and then some of it directly given to baby. So there's ways to include the breastfeeding mom in the protocol and what may be beneficial through that relationship with her child. But depending on age, I may bring age and what shows up. I may be bringing in homeopathic supports. So no-sodes are homeopathic remedies made from the pathogen that you're trying to address. There's absolutely no physical remnant of that pathogen left in the remedy that we're using. And that helps the body to clear that specific infection or address that specific infection. Or we can use herbal things depending on what's showing up that can eradicate worms or be antimicrobial or even antiviral, because there's some viral things that may show up on a GI map, or antifungal, and help that way. Depending on age, depending if mom is breastfeeding, depending on how big the pathogen may be, we've got herbs, we've got binders, we've got homeopathy, and maybe even just nutrients and foods. Like let's bring in lots of garlic in our cooking because that's antimicrobial and that can help address some of the things that we're seeing. Or let's bring in these food-based binders, like increasing our nuts and seeds or increasing chia seeds or psyllium husks, so that we can ensure that we're eliminating and not necessarily depending on something like a big binder that can be problematic and constipating long term.
Yeah. Okay. And then what about parents who aren't breastfeeding but are choosing to formula feed? It's no secret that breastfeeding obviously supports the gut better than formula feeding, but
Mhm.
families obviously do choose to formula feed. Do you think that looking at the formula you're on is beneficial? They're not all made equal, but they all do go through some sort of testing so that they can be eligible to be put on the market. But is there any sense in adding in something for formula fed babies? And is there benefit to looking at what type or brand of formula you're feeding your baby?
Yes. So there are one of the things that I would probably look at would be seeing if your formula, that depends on the strain too. I'm thinking out loud.
Yeah, I love
Um,
it.
there are some microbes on the GI map that, if low, breastfeeding can be more supportive in correcting because breast milk has HMOs. Formula does not, to my knowledge. And so you may want to include an HMO supplement for a kid on formula feeding, depending on what shows up on their test. And then, I mean, there's so many possibilities. There may be things that we can add in to formula that would be beneficial based on results, but that's probably as far as I could go without having an actual test.
Yeah. And
Yeah.
don't forget, listeners, like donated breast milk is
Yes.
totally an option. So there are banks out there which that can be very costly, but Eats on Feets, EATS on FEETS, Eats on Feets is a great website to find donor milk in your area. You can also connect through online websites to other moms who are donating breast milk. So you have options to get breast milk into your baby if that's important to you and you yourself are not nursing. Okay, so can we talk about probiotics? They're on everybody's mind. When we talk about gut health, everybody wants to add in a probiotic. I know there are so many strains out there. There are some that need to be refrigerated, some that aren't, some that are full of fillers, some that are very high quality. Some people say it is pseudoscience. So help us understand the data behind probiotics, what we need to know when choosing one, and maybe who's a good candidate for one. What kind of things would we be targeting with a probiotic?
I actually don't recommend probiotics unless you've had a stool test.
Wow.
So
No,
don't
I
don't
love
pick
my
one up.
probiotic.
I will tell you why. Specifically, I've had at least 10 eczema cases at this point where parents had their child on a probiotic and their eczema is not getting better, or they started the probiotic and then eczema came about. And you do the test, and hey, this little strain here is off the chart high and can lead to worse skin conditions. And it's the strain you're giving them in your probiotic. And so you can lead to microbial imbalances if you don't need that specific strain. Now, most probiotics are like two strains. You've got some bifidos and you've got some lactobacillus. And generally, you can get on the higher end with bifidobacterium and not be an issue, but lactobacillus can get too high and become problematic. It's just, it's better to test and not really take something blindly. You can create an imbalance. When these microbial strains become too high, they start to suppress others that you might need as well. As helpful as having access at your fingertips is, you may not need that probiotic at all. And what you need is something entirely different. Maybe you need a dietary change to help, because there are different dietary things that you can do to increase microbes that you need or decrease others that you don't. And having that kind of information in your back pocket is probably more useful than a probiotic in your cabinet.
Yeah, wow. Okay, so something I just learned here is I need to do a poop test. I got to get one done, you guys. I'm gonna have to poop in a cup and send it off to someone to test it. Oh,
Yes.
okay, you have heard me say a million times, test, don't guess when it comes to pregnancy and making decisions in prenatals and making decisions about how to manage the end of pregnancy. And it seems like that's very applicable here too. It's just test, don't guess, because everyone's body is going to be so different. So when
Mm-hmm.
we do test and we get back the information on, okay, yes, a probiotic is correct for you, here's the strain that's specific to you. How should we pick pick a probiotic. A lot of people are buying supplements off of Amazon. Some are good, some are bad. Should it be a prescription? Those can be very costly. So, what's the happy medium of finding one that is accessible to a lot of people, but is a high quality, not filled with fillers?
Generally, I'm going to ask you to steer clear from Amazon.
Yeah.
Generally, I'm not going to say always because I'm also a realist. And there's at least one company that I will purchase my product from on Amazon. I'm pretty sure it's okay to say
Yeah.
it is perfectly fine to order from Supreme Nutrition. I
Okay.
don't think that they have a probiotic, but the reason that I'm okay with that is because they control all of the shipping. So it's like their warehouse. So you're ordering from them directly. So if you know that the product company is handling all the shipping and delivery that you're ordering from, then go for it. Amazon's going to get it there way quicker than some online dispensary. Most of the time, however, you don't want to be ordering from third parties. So if it's just a random seller who has this item and not the, like, you're going to check the seller and make sure it's the name of the company kind of thing, then that's where I would say red alert, steer clear, look, like, pay the extra whatever amount of money to make sure that you have something that's supposed to be in that supplement, because there's so much potential for contamination when it's not the right product. Do we need prescription probiotics? Not always. There is research for a C. diff infection that you could go and get over the counter Culturel and high dose it. And Culturel, people are like, that's the bottom of the bottom, right? No, it's not. There's research showing the strains in Culturel can clear a C. diff infection, and you're spending $10 over the counter for that. So it's not always that you need some high fancy whatever. I think it's you just need to know and have information on what's going to be most useful for your specific case. And this is where working with an appropriately trained practitioner is going to be the most beneficial for you, because how many people know that you can clear C. diff with a high dose cultural probiotic? Not many, but I did. And I just saved you how much money by going and getting that versus a $50 bottle that only lasts you a month. So having that kind of relationship with a practitioner can be beneficial with those results.
Yeah. How do you feel about the brand Pure Encapsulation?
I like them. They were recently bought.
Oh
And
no,
so
by who?
I don't remember. I
Tell
remember,
me it's not Nestle or Johnson.
I don't think it's either of those. But I
Oh,
remember thinking, oh no, if you're bought, then it might, like, there could be quality issues down the line. So I'm still using them. I have some products that are like go-tos for clients, and it's a well established brand that I would just keep my eye on news.
keep your foot on their throat, people, just like
Yeah.
everything else we're doing right now. Okay, so when people go to traditional pediatricians or mainstream pediatricians, they are often met with a prescription of a steroid, a topical cream that you put on eczema to help make it go away. And in many cases, it does work, but you stop using that cream and your eczema comes right back. So, talk to us a little bit about what parents need to know in order to make an informed decision on whether this cream is right for their family or not, and what are some other evidence-based ways that we can manage eczema symptoms if people decide that the steroid cream is not really for them.
Oh, okay.
I
So
know.
this is a big one. I honestly think that steroid creams are a problem. And mm, to my knowledge, most parents are not informed on the potential problems that they create in children. There, it's funny, there was a study, I don't know, like 2020-ish, that did like a review of pediatricians' use of steroid creams for eczema specifically in children under 2. And their what is it called? Conclusion was that they weren't using it enough. And I was like, that's so funny to me. So some of the issues that steroids can cause is HPA axis suppression. Because it's a steroid and your adrenal glands are what produce steroids, prolonged use will lead to your adrenal glands not being able to create its own steroids. And HPA, for those who may not know, is hypothalamus, which is a part of your brain, pituitary, which is another part of your brain, and then adrenals. We often see the suppression as well of another hormone, ACTH, which helps with cortisol production. You can have we've seen connections to diabetes from steroids because of a cortisol imbalance. So the illustration I use with clients is if your body was a school and all of your cells were classrooms, your bloodstream is a hallway and glucose is the students, right? Cortisol is the fire alarm that makes all of the students leave the classrooms and rush into the hallway to leave the body because it's a red alert. Insulin would be your security guard that makes you go back in. So because cortisol is leading to steroids is leading to a cortisol imbalance, it leads to a blood sugar issue that can end up in diabetes. It can disrupt your sodium balance because it functions as a mineral corticoid like aldosterone, which is related to potassium. So there's an antagonistic relationship there. It can lead to reduced mineral density, to reduced or decreased growth rate. It can lead to your skin atrophy or epidermal thinning. You become dependent on it and then you can't come off. And so topical steroid withdrawal. And so all of these things are possible. And then there are nutrients depleted by steroids. So magnesium is depleted, which is necessary for skin health. Potassium is depleted, which is necessary for skin health. And vitamin D and vitamin B9 are depleted. And this is only with the level 1 steroid hydrocortisone. I'm not even talking about like level 3 and up. This is the bare minimum that's mostly prescribed by physicians. And so utilizing a steroid, I've had clients where I'm like, I don't want you to stop it because your eczema is so bad and it leads to such terrible life quality that while we work on these underlying things, it's something that I would say keep in. That's not the majority of my clients. I would say it's a minority. But another reason that I don't think that steroids are beneficial is that eczema is not a skin problem. Eczema is deeper than the skin. When something happens to the skin, it is a byproduct of something else occurring because your skin is the final drainage passageway of your body. And so if the body is not detoxing things normally through urine, through fecal matter, then the skin becomes this extra place to finally get rid of something. And so if we're having skin problems, there's other problems occurring within the body that need to be corrected. And steroids are just masking that by correcting the skin and not allowing your body to give you the message it needs to send. And that's what eczema is. It's a message that's being sent that something is off and needs to be corrected. As helpful as topical steroids can be, they do not bring about resolution and they can bring on so many problems. And so I caution parents with its use.
To even start it, right?
Oh, absolutely.
Okay, so where do we start? We notice there's eczema. Obviously, we talked about the GI map. That's a great place to start. If that's not an option for you or you don't want to start there, where else could parents start?
The three places that I think are important are going to be gut dysbiosis, so that GI map is there. Heavy metals is another one because heavy metals will displace specific mineral elements necessary for proper skin health. For example, lead can displace calcium, and calcium is necessary for your keratinocytes or your cells that create keratin in your skin to be a protective barrier. So if we don't have or if we have too much lead present, it's displacing calcium, then our skin barrier, like a castle, starts to break down. That's what's happening. And so instead of having this strong barrier to present itself to the rest of the world, we've got all of these cracks in our castle. And then the other are different micronutrients. It could be minerals, as I mentioned, calcium here. Zinc is a really important skin mineral, potassium as well. Or it could be vitamins, different vitamins necessary because they have these synergistic or partnering relationships with each other to help those levels remain where they should be for optimal health or optimal skin health. So micronutrient deficiencies need to be addressed. And these are the three things that I'm looking at with every eczema client. Heavy metal toxicity needs to be addressed and gut dysbiosis needs to be addressed. Sometimes I will add this caveat in there as well. Gut dysbiosis may be a mold issue. And so we can have fungal or mold issues come up. And that would be best addressed not with a GI map, but something like a mycotoxin test or an organic acid test, which are urine samples, because they are better at measuring mold or fungal issues.
Wow. Oh my gosh. What a hot topic, too, is mold. I feel like every third person I come across has been exposed to mold and they're just struggling with something that is mold based. And I've never heard of as much mold education as I am right now. And it's so concerning just to hear of the seemingly random places that you can be exposed to mold that so many of us just don't even consider. And that's a rabbit hole I could really
Mhm.
just get so lost in.
It's, I have a friend and a colleague, she's a colleague as well, that when I am suspecting mold, I'm like, you are going to go meet with Rachel. She is a functional nutritionist and she has finished her training as a certified mold inspector because of her own family's experience with mold. And so now she just works with families in making their homes healthy, is what she says, because there's so much mold damage that has led to so many people being so ill. So if I ever suspect mold, I'm like, you need to see Rachel, rule that out as a problem. Because if it's a problem, no amount of supplements or eradication is going to outdo your environmental exposure. And so that has to be a big consideration too.
Yeah. Oh my gosh. This has been such a great conversation. Thank you so much for being here.
My pleasure. Thank you.
Yeah, you guys, I know that this can feel super overwhelming. And I know that sometimes listening to episodes like this, I get like that too. I hear episodes and I'm like, oh my God, I just added 50,000 things to my to-do list. Don't let it be overwhelming, you guys. Small steps are how you start.
Mhm.
Small steps actually do make a big difference. Start with what's in your immediate. Start with the things that you're picking up at the grocery store. Start by filtering out the easy stuff. As you run out of one cleaning product, replace it with something that's a little better. It does not have to be an entire overhaul. You don't have to take a week off work to do this. You don't have to spend thousands of dollars all up front. Little baby steps will make a huge difference. One of those you can start by following Dr. Nina Marie on Instagram. But how else can people connect with you if they were interested in learning from you or working with you?
Instagram's the primary place that you will find me. I am always responding to DM. So do not hesitate to reach out to me. I love interacting with people. It's one of my favorite things about having that kind of platform. My website is drninamarie.com, and doctor is the whole word, not the abbreviation. And just reach out. I love being able to be a resource at the very least. I've gotten on calls with people where they're like, I want to work with you. And I'm like, you know what? No, this is going to be better for you. This person will be a better option. I'm happy to point you in the right direction because that's more important to me, that you are working with who you need to be working with. And then we can take it from there.
Oh my gosh. And you can feel that from your Instagram. It's one of my favorite parts of you is that you actually are so relatable. And I don't know, I just love your Instagram so much. So people don't miss out on that.
Thank
And
you.
Dr. Nina Marie, thank you so much for being here. This has been such an informational podcast. I know so many people now have questions and tangible steps that they can take back to their provider or seek out a new provider to help them get the answers that they probably have been looking for. All right, you guys, I'll see you in the next episode. Be sure to follow Dr. Nina Marie on Instagram, and you can find me at Tranquility by HeHe or at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye! Thank you so much for tuning in today. I truly do value this community and I love hanging out with you. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent. It's an honor to be your go-to gal when it comes to preparing for your baby. If you found today's episode helpful, share it with a friend. Share it with someone who could use evidence-based information to help them have an informed and confident birth. I'd love to hear what you have to say and read your sweet words. By leaving us a review, you are helping other expectant mamas and their families find the podcast so that we can reduce birth trauma and improve maternity care in the U.S. one birth at a time. If you're interested in joining the Birth Lounge, go to thebirthlounge.com. If you want to connect with me on socials, you can find me at Tranquility by HeHe on all platforms. Until next time, stay educated, stay supported, stay confident. Bye!